I think last time we had a meeting, it was the day before I was going to be attending a day-long CIT training, and I promised I would come back and give a report. So on September 27th, I attended an 8-hour training on CIT, the crisis intervention training that the police officers are going through. It was held back-to-back with use of force training, so all the officers were getting the 8-hour training that is now part of what they'll get annually. So I was impressed. I thought that overall it was well done. The first 2 hours was a mental health practitioner from one of the area community mental health centers doing an overview of psychiatric diagnoses and symptoms and how a person with certain psychiatric diagnoses might present, so that officers might, be able to better discern what was a symptom of an illness versus what was just not cooperating for other kinds of behavioral reasons. There was engagement on the part of the officers. There was Captain James Purcell, who's the officer who's the CIT coordinator, was present and offered lots of examples of behaviors that he's interacted with, and then officers in the audience also asked some questions and gave some examples. And then Officer Purcell Captain Purcell ran through the crisis intervention training policy, sort of went through it line by line so that the new policy would be understood. People had a chance to ask questions, and that was informative. There was a section that was conducted by another officer whose name I didn't write down, on de-escalation techniques and communicating and active listening. So I thought those were all useful tools that officers all need to be aware of and use and hopefully practice. This session did not have a practice component. This 8-hour training is the one that all officers are going to be going through, and then there'll be an annual update. The updates won't all be exactly as this one was. They'll focus on other aspects of mental health, like children and adolescents, how to interact with children and adolescents around mental health issues, addiction issues, the special challenges that older adults might present with, who might have dementia or other kinds of disorders of older age. So the 40-hour training for specialized CIT officers is currently being developed, and that one will include a lot of role-playing and sort of hands-on participation, but this one did not have that component. There were some videos that were used that were produced by mental health advocacy organizations that sort of depicted a person struggling with getting through their day with symptoms like hearing voices, experiencing hallucinations, so that people might have an appreciation for what somebody might be struggling with, and so what might be occupying their attention and keeping them from being able to listen to and understand directions in any given moment. So I thought that was useful. And then there was discussion about the changes that would be helpful to be, now that there's more of a flashlight being shown on the Cleveland Division of Police and what changes police need to make to be better able to respond to the needs of individuals with mental health challenges. Now the flashlight's back on the mental health system appropriately, because there are lots of ways in which the mental health system needs to improve to better serve the population, because wherever the mental health system fails, the police are the ones that get called to step in and they can't not step in unless the mental health system can step in. And so there was some discussion about it would be really helpful if, officers, despite the training that they're getting, they're not necessarily going to know what exactly does this, what level of service does this person need, nor should they be expected to be able to figure out. So what the police officers were asking for, and I think it's a really great idea, is for there to be sort of the idea of no wrong door, that wherever they take a person, that person can get then, sort of assisted through the system to end up where they need to end up, whether it's maybe if they need psychiatric hospitalization, they'll end up in the hospital. But if that's not what they need, maybe they'll end up in a crisis center more for a shorter duration. Or maybe if they don't need that, they'll end up linked with outpatient services that can be ongoing. So right now, the system doesn't really have no wrong door. There's lots of different doors, and they don't all connect. And so that is something that the mental health system will need to work on to provide.